Today, the president and CEO of Baystate telling Western Mass News the hospital is experiencing multiple crises. On top of the pandemic, hospital leaders are having trouble finding new staff. A Western Mass News reporter, Paris Dunford, spoke with him earlier this morning and has the latest in an update now. Paris?
Chris, Baystate Health president and CEO Dr. Mark Keroack wants all of us to know they're in crisis mode.
But Baystate is currently facing, I think, 4 major crises.
On Thursday, President and CEO of Baystate Health, Dr. Mark Keroack, held a virtual news conference to inform the public of current issues the hospital is facing, specifically 4 major crises. One is the obvious, the COVID-19 pandemic, which leads to number 2, a capacity management issue. 3 is an increase in behavioral health needs. And 4, Dr. Keroack says they are experiencing a serious staffing shortage. Let's break down number 1 and 2 to start. Dr. Keroack says the hospital is operating at 10% over capacity and has been for the past few weeks.
Baystate Health is licensed for 988 beds. Today, or last midnight census, there was 1,095 inpatients at Baystate.
He says it's largely due to the COVID-19 pandemic. COVID patients tend to stay longer while they recover, so there's less turnaround of empty beds. Plus, the extra precautions because of COVID, like putting on PPE, have staff taking longer than usual in between patients. He also says they aren't rationing care right now, but they might have to if cases continue to increase.
We might have to make choices about who does or doesn't get one of these technologies.
And for the third problem, Dr. Keroack says there has been an increase of people looking for behavioral health needs. And unfortunately, it's mostly children looking for that help.
At Baystate, it's typically 1 or 2 dozen individuals with a slant toward pediatrics. And the problem is the availability either of inpatient behavioral health beds or partial hospital beds or residential facilities.
And when Western Mass News asked what his biggest concern is, he said the staffing shortage. He says Baystate currently has 1,800 job openings, and they had an average of about 500 pre-pandemic.
We've really put a lot on our people. We've asked them to do a lot.
He says 1 in 5 nurses have left the business or retired. There's not enough new nurses in the pipeline to make up for those losses. He says that's due to a shortage of faculty at nursing schools.
We've got waiting lists of people wanting to go to nursing school, but they're limited by the number of clinical placements and the number of faculty that they can get through.
Now, in this news conference today as well, Dr. Keroack also gave us some insight about the hospitalizations at Baystate. He says he's seen a continuing increase of positive COVID-19 patients in the hospital, with about 130 just yesterday. He says 1/3 of the cases are breakthrough cases, with vaccinated older patients coming in with more mild symptoms. But he says the other 2/3 of the cases are unvaccinated patients, mostly younger, experiencing serious symptoms. Dr. Keroack says he's seen those patients' lungs fail, and they typically have to stay much longer in the ICU. Reporting live in the studio, Paris Dunford for Western Mass News.